Hi, this is Dr. Rajput. We are going to talk about the skin cancer. The skin cancer is caused by sunlight. The sun rays contains the ultraviolet rays A, B, and C. UVA is the longest wavelength and passes through the ozone layer and crosses the skin and causes the skin changes. Ultraviolet B cannot cross the ozone layer, and same is ultraviolet C. Though ultraviolet C is very dangerous, but it does not reaches the earth. It takes only 15 minutes for skin to be affected by sun and 12 hours to show full effect. Periodic longer exposures causes skin cancer. Even in the cloudy and cold days, when there is no high temperature, they can still affect the skin and cause the skin cancer. The second important point to remember is that nowadays it is a fashion to have a tanning beds, and the sun lamps, they are equally bad. They can cause skin cancer. There are 3 types of skin cancers. One is basal-cell carcinoma, second is squamous cell carcinoma, and third is the melanoma. The basal-cell carcinoma is the common skin cancer of all, and there are 2.8 million cases are reported in the United States each year. Basal cell carcinoma arises from the deepest layer of the epidermis, and it shows up as a pink growth, red patches, sore-like, shiny blisters or scars. This cancer stays where it is formed, and it does not metastasize to the other parts of the body, and it can be easily cured by surgery. The other is the squamous cell carcinoma, and there are about 700,000 cases reported each year, and there are about 2,500 deaths. This skin cancer appears in the epidermis and in the squamous cells. And this looks like wart, it can bleed, it's elevated growth, and it is eroded in the center. Mostly it happens on the face, arms, which are exposed to the sun rays, but however, it can also be found on all parts of the body. The third is the most deadliest of all, and it is melanoma. And it is produced in the color producing cells, which are called pigment melanocytes, and they are present in the epidermis. The important thing is, if any mole that changes color, bleeds, or increase in size should be considered as a skin cancer until and otherwise it is proved by biopsy that it's not a cancer. The important thing about to recognize melanoma is by abbreviation A, B, C, D. A stands for asymmetry. If you see the lesion and divide into two halves, the two halves would not be symmetrical. They will not be alike. They will be different. B for border. The border would not be smooth and regular. In cancer, it will be irregular. Color. There will be multiple colors in cancer. It can be red, brown, brownish yellow, and yellow. And the D is for the diameter or the size, which is the 6 millimeter. They will all be greater than 6 millimeter. Now you want to know the risk factors. The history of cumulative lifetime, sun exposure, and sunburn in the past. The second, personal and family history of skin cancer. Third, atypical mole and many numbers greater than 50. Next, freckles and easy skin burning in sun. Next, natural blonde with light skin, hair, blue or green eyes. Next, immunosuppression by disease, medication or radiation treatments. Then the question comes, what is the treatment of basal cell carcinoma, squamous cell carcinoma, and melanoma? If they are diagnosed very early, they can be treated and cured. But if it is delayed in diagnosis, melanoma can be fatal. The treatment of choice for basal cell carcinoma and squamous cell carcinoma is Mohs surgery, M-O-H-S surgery. Mohs surgeries can be done in office or ambulatory center. The surgeon takes up the skin layer by layer and sees under the microscope, then and there. If he finds or she finds the cancer cell, he goes again and take off the layer. The procedure continues till the margin is free from cancer cells. This procedure preserves the healthy skin. The success rate is 97 to 98%, very high success rate. The treatment of melanoma depends on the stage of the cancer, location, and your overall health condition. There are stages of melanoma: 0, stage 1, stage 2, stage 3, and stage 4. The treatment is surgery, chemotherapy, immunotherapy, targeted therapy, radiation, and clinical trials. The melanoma cells change into BRAF gene or c-KIT gene. BRAF gene people live longer with some medications like vemurafenib, trametinib, and dabrafenib. But these drugs are not cure. the c-KIT gene, patient responds to imatinib and nilotinib. The prognosis of melanoma depends when it is diagnosed, the stage of it, comorbid conditions, and treatment modalities. Now, how can you prevent and protect yourself? Number one is stay in shades as much as possible during the day, but especially at noon when radiation is at its peak. 2. Wear white clothes, sunglasses, wide brim hat. 3. Stay away from tanning beds and sun lamps. Next, use sunscreen protecting from UVA and UVB and 15 or more SPF, which is sun protective factor. It means that lotion will protect you 15 times more from sunburn if you had not put it on. See your doctor if you see any abnormal skin lesion. And please remember 2 points. Not too much exposure to the sunlight or the tanning beds or sun lamps. And second, if you see any lesion on your skin which is increasing in size, bleeding, or changing the color, you should see your skin doctor or dermatologist and get help. I hope it might help you to increase your awareness about this skin cancer. If you need more information, please see HT